Hello, thank you for selecting this video. My name's Ollie Morris and I'm a GP in Southampton.
And my name's Sally Hinder and I'm a health visitor in Farnborough.
And in this short video, we just want to talk about some of the issues that can arise when you've got a child who's got a nasty cough or a cold, and some of the questions you might have, and some pieces of information that might help you manage that.
So I will start with discussing what to expect with coughs and colds. So what we know is that young babies in the first year, they get quite a few coughs and colds, and they can last something like 2 to 3 weeks, sometimes a little bit longer. And a lot of the time babies get up to about 8 episodes of coughs and colds in the first year. So with the episodes being so long, sometimes it does feel like it's the same thing going on for absolutely ever and ever. And that's not necessarily the case. Often it is separate infections, separate viruses rather, and they just don't necessarily recover from one before they then go into the next one. So that can be quite normal for young babies.
And then the next thing is what sort of things to expect from your baby or child when they've got that. So obviously a cough going on and on, quite a lot of snot. Some things that causes anxiety can be a noisy chest or a rattly chest. So you might notice when you pick up your child or hold your child, you can feel a rattliness in your chest. That can be quite normal, and on its own, it's not worrying. It's just a sign that there's a bit of mucus in the chest moving around when they breathe. And providing that their breathing is reasonably comfortable and the other things are okay that we'll discuss later on, no real need to worry about that cough. You'll probably also notice that things are much worse at night. They will often get worse with respiratory problems, so that they'll be more disrupted, broken nights. And that's really not great for you and your family, but it's not dangerous per se. So it's quite frustrating for everyone, but it's not dangerous as long as they're getting enough, breathing comfortably and feeding okay. So you also might notice some watery eyes and obviously quite a blocked nose. And with babies, when they've got blocked noses, they really don't feed so well because they like to be able to breathe through their nose. So they like to be quite snacky and come on and off the bottle a lot, or on and off the breast. Again, that's quite normal. And as long as they break up their feeding and still get enough fluids, that's okay.
So I'll just talk a little bit about what you can do to help, what treatments you can use and those kind of things. So with coughs and colds, there's not a huge amount that you can do. There's not a lot of treatment out there. What you can do from relatively early on is using saline drops into the nose, and that just breaks down some of the mucus that they're bringing up and helps babies to breathe, especially when they're feeding. Obviously, the nasal passages are very small and very important for them to be able to breathe when they're feeding. Once they get over 1, you can use a spoonful of honey. Sometimes that might just ease those symptoms of the discomfort in the back of the throat a little bit to ease their coughing. And then once they get over 2, you can think about using some of the VapoRub type products that you'll see in the shops, and that can sometimes ease those symptoms. It can help to open up the airways and just make it a little bit easier as well. You can use things like paracetamol, but that won't have any impact on how long this is likely to last. It's not something that we use for managing fever or anything like that. It would only be to try and manage some of those symptoms, to try and help baby or child to get through that period of time whilst they've got the more uncomfortable symptoms.
Then often the main concern is, am I missing something more significant? Do we need to do something for our baby or child? Do they need some extra help? So what is more concerning in a child with a cough or cold-like symptoms, and when do you need to go and get help for that? So for this, we've developed materials on the Healthy Together website, and a lot of the information we're giving in this video is repeated on that. But there are certain things to look out for, and the 2 main things I like to think of when I'm assessing a child is to do with their breathing. So how comfortable are they with their breathing? Because obviously a child that's struggling with its breathing may need more help and may need a bit more support. And the other thing that's tightly linked to that, particularly in young children, is feeding. Because if they're not breathing comfortably and having to work quite hard for the breathing, they tend not to feed so well, and then there can be a risk that they get a bit dehydrated, and that makes them sicker as well. The other important point to make is that obviously in this video we're mainly directing at people with children who have no long-term health conditions. If you've got a child that's got asthma or had some sort of chronic lung problems or has had a significant tricky time early in their life and under the care of a specialist or regularly seeing their GP, you might be a bit more reasonably understanding to contact your GP and seek a review earlier, but I'm sure you'll become very expert at recognising when they need help yourself. So what are the key things about breathing? So really an assessment of looking at the child and seeing what's the breathing like. And you might want to literally lift up their top and look at the skin and looking at how their chest's moving. As healthcare professionals, we're trained to look for increased effort of breathing, but anyone can look at their child and say, now that doesn't look quite right. They're just putting a lot more effort. They seem quite out of breath. If you count their breaths, you'll probably notice even when they're completely healthy and well, they breathe faster than we do, particularly younger children. So you'll get a bit of a sense of what looks normal. But if a child's at rest, not doing anything and breathing quite fast and effortfully and extra muscles being used, it's probably well worth getting someone else's opinion on that. And you can call 111 or you can select your GP and they'll arrange an assessment. That might be by video, it might be bringing you in to see you or just asking some more questions. Then the other thing, as I said, is about feeding. So you can get a bit of a sense of that in terms of knowing how much they normally take. And if they're still taking sort of about half their normal level of fluids, that's okay. If they're still producing wet nappies, you know that they're not getting particularly dehydrated. And you get a bit of a sense of just looking at how sort of bright and what their colour's like. There are other things that we look out for. And in the Health Together website, we break them down into red, amber and green features. So red features are things that really are concerning, and it wouldn't surprise you. You've got things like if you're going blue around their lips because they've got so little oxygen, or if they're having long pauses in their breathing, or sometimes babies do a thing called grunting. So it's a nasty noise they make each breath as they breathe in or breathe out usually, or they're just too breathless to feed when they're young or to talk or eat when they're older. So those are all very concerning signs. You want an urgent assessment. We all know about the glass test, so that rash that doesn't go away when you press on it, that can be a concerning thing in a child that's obviously unwell. And in young children who've got a high temperature, we're always more concerned. So any child under the age of 3 months with a temperature above 38, that probably needs a more urgent assessment. Things where you might want to look for your GP or health visitor for some advice would be where you're just concerned the breathing's a bit more effortful than you're comfortable with, but not so bad that you think they need to go straight to hospital. If they get that noise, a stridor, when they're breathing in, particularly when they're not upset, they're making a kind of noise as they breathe in, that's a concern as well, and they need to be checked out. And if you're worried about the hydration, that they're just not getting enough fluids on board. So those are things that you can look out for. There are other things that you'll see on the website, but those are probably the main points that I would be thinking about.
So we just wanted to talk a little bit about antibiotics and why they're not given out when babies and children have coughs and colds. So the virus that causes the majority, at least, of coughs and certainly all colds is not something that antibiotics work for. And if we were to, or if GP surgeries were to give out antibiotics for things that antibiotics don't work for, then we will create more and more antibiotic resistance. And then those infections and diseases where we do need antibiotics for them to fight the infection, they will become less efficient and effective. And that will mean that we may at some point run out of antibiotics that will work with those diseases. So it's really important. It is understandable that if you go to a GP, you want to come out with a prescription for something, and that you want to be able to give something to your baby, but sometimes actually just doing those things that we've mentioned earlier is going to be enough, and then just kind of riding it out with those symptoms that we mentioned. And there are places that you can go for advice. We've obviously the Healthier Together website is a really good place, and that will guide you to who the most appropriate person is to contact for advice, whether it be your health visitor, whether it be a pharmacist, whether it be your GP, the 111 service, or whether you do see some of those red flag symptoms that were mentioned earlier, and you do need to call 999 or go to the local hospital. That will be a really, really good website to let you know what to do. And also, it just gives you a little bit of advice on some of the things that we mentioned about how long it's likely to last, and some of the things that you can do to try and treat a cough and a cold, so that your baby feels better as soon as they can, really. Thank you.
So thanks very much, Sally, and thank you for watching this video. And we'll hoping to put on some other videos as well shortly for other conditions.